all, I'm Dr. Neema Bhat, Hematologist, bone marrow transplant physician and Pediatric Oncologist. I'm speaking out of Therapy, Hematology and Oncology Center, which is a comprehensive center for holistic health, your overall health, well-being, as well as specialized care directed towards blood and cancer disorders. I usually speak about awareness issues. So January is considered the month for thyroid health awareness or thyroid awareness all over the world. So what is thyroid? It is a simple gland that is present in our neck and plays a huge role in regulating the hormonal well-being of a person. So thyroid makes various hormones, basically considered T3 and T4, which is required for maintaining our metabolism and plays a vital role in our day-to-day functions and well-being. So what is it that you need to know on this, during this month of thyroid awareness month? So as I said, thyroid plays a huge role in controlling our hunger, in our hair growth or the volume of our hair. It controls our weight, it controls our mood swings, it controls our temperature controlling abilities, so you can feel either too cold or too hot if your thyroid is abnormal. So and definitely plays a huge role in the growth, especially when growing children are considered. It also plays a role in sugar control in our body by interacting with various hormones in the body. So when should you think about testing for thyroid disorders? Interestingly, India is one of the leaders of hypothyroidism in the world. So if you consider hypo or reduced production of thyroid hormones as a disease, overall the prevalence or incidence is approximately around 2%, whereas in India it's as high as 11%. And this is only the detected or reported numbers. We should remember that in India, whatever is the prevalent condition, everything doesn't get reported or registered. So whatever numbers we're looking at is probably just the tip of the iceberg. So how do we make sure to increase the awareness? If you know any friend, a relative, or a close person who has been suffering with difficulty in losing weight, or constantly putting on weight or being overweight, or sometimes even difficulty in gaining weight, please push them or encourage them to get their thyroid level tested. If you know someone who's had a lot of hair fall, someone whose appetite has been on the varying extremely, someone who's not at all being feeling very hungry, someone who has a lot of temperature control issues, so feels extremely cold, extremely hot in different weathers, so make sure you talk to them about how important the thyroid functions are and encourage them to get it checked. So what are the tests that we do as doctors to diagnose thyroid disorders? First of all starts off with a detailed physical examination and a history. So we look for these things: how was the appetite, how was the mood, how was the weight, is there weight gain or weight loss, is there any temperature controlling issues, is there any hair fall. So we assess on all these things as far as physical history goes, and then we examine the thyroid gland, which, as I said, is present inside the neck. It can be sometimes clearly visible, especially if the thyroid gland is enlarged. Based on what we suspect, we ask for thyroid function tests, which ideally have to be done in a fasting state, which is after you have dinner. There should be a gap of at least about 10 hours the next day, and before you consume any milk or sugar, coffee, tea, just water is acceptable, but anything before you consume anything, thyroid function tests have to be checked. And we usually check for T3, free T4 and TSH. These are all the various parts of the thyroid hormones that we check for to see where the levels stand, and is a person hypothyroid, hyperthyroid, or euthyroid. So is their thyroid functions normal, above normal, or below normal? Along with this, if there is a suspicion for thyroid cancer, depending on examination of the patient, that we also request for what we call a scan of the thyroid gland, which can pick up nodules, and if required, it can be biopsied so that any cancerous condition can be diagnosed at the earliest. Once the condition is treated, if the problem is significant, then you might need to see who's called an endocrinologist. So they are hormone specialists who might be able to diagnose you with the correct thyroid condition and put you on the appropriate medications so that your condition might improve. If you are diagnosed with thyroid cancer, then you will need to meet an ENT surgeon or a surgical oncologist who is a head and neck specialist. So if surgery is required, or if it has to be medically treated, you have to meet a medical oncologist. If you have any other doubts or questions regarding thyroid health awareness, please feel free to contact us here at Therapy, Hematology and Oncology Center. Thank you.